Like 15 people.
Good evening and welcome to the September 8th, 2015 work session of the Gaston County Board of Commissioners. My name is Tracy Philbeck and I serve as chairman of the board as well as commissioner for the Dallas Township. I'd like to welcome our viewers and thank Time Warner Cable and AT&T for making this possible for our citizens. For our television audience, I'd like to present to you your Gaston County Commissioners beginning on my right.
Alan Fraley, Cherryville Township.
Good evening, Chad Brown, Riverbend Township.
Good evening, Mickey Price, South Point Township.
Good evening, Jason Williams, Gastonia Township.
Good evening, Joe Carpenter, Crowders Mountain Township.
Thank you, gentlemen. Our first item is proclamations, commendations, awards, and certificates. I will be up first with a proclamation for Red Ribbon Week, and then next, Commissioner Price with a proclamation for long-term care residents' rights. Mr. Jonathan Henderson, if you want to come forward and.
Thank you, sir.
Right here. How are you? Whereas communities across America have been plagued by the numerous problems associated with illicit drug use and those that traffic in them. Whereas there is hope in winning the war on drugs, and that hope lies in education, drug demand reduction, coupled with the hard work and determined organizations such as the Mecklenburg County Young Marines of the Marine Corps League to foster a healthy, drug-free lifestyle. Whereas government community leaders know that citizen support is one of the most effective tools in the effort to reduce the use of illicit drugs in our community. Whereas now therefore be it resolved that the Gaston County Board of Commissioners proclaims October the 23rd through 31st, 2015 as Red Ribbon Week. And if you want to make a couple of announcements or comments. I'll give you this.
Appreciate it, sir.
Would you like to say a little bit about your organization?
Sure.
Okay, right here.
The Young Marines is a national youth organization. We have units across the United States as well as Guam and Japan. We're a youth education program slash ROTC type program. We accept children between the ages of age 8 to 18, male and female. Mostly we like to talk to kids about not using drugs, educate them on how to be a good citizen, and give back to the community. We do creek cleanups, go to the VA, help with the veterans and bingo. We participated in the Memorial Day Parade in Washington, D.C. back in May, of which we were invited to attend. We went to Arizona and participated in the Navajo Code Talkers event. We're planning on going to Hawaii next year for the Pearl Harbor ceremony. But we're always staying busy and trying to get in the community and make an impact on everybody around us as well as the Young Marines. Thank you.
If they want to, they can stand up front.
Yes,
They can get a picture.
Yes, sir. Thank you.
Okay.
Can they pass out the resolution?
Absolutely. And then if they want to just stand up front. and take
Yes,
a
sir.
picture.
Okay.
Thank you.
We'll just stand up here in the center and we'll get a photo.
Would Miss Cindy Englert please join me at the podium?
Hold 1 second, Commissioner Price. I think they're going to take a picture.
Thank you. Thank you.
With who?
Thank you, guys.
Thank you. Thank you.
Whereas there are more than 1.6 million individuals living in 16,000 nursing homes and 1 million individuals living in 50,000 board and care assisted living facilities in the United States. And whereas the Federal Nursing Home Reform Act of 1987 guarantees residents their individual rights in order to promote and maintain their dignity and autonomy. And whereas all residents should be aware of their rights so they may be empowered to live with dignity and self-determination, and whereas we wish to honor and celebrate these citizens to recognize their rich individuality and to reaffirm their right to vote and participate politically, including the right to have a say in their care. And whereas the individuals and groups across the country will be celebrating Residents' Rights Month with the theme Care Matters to emphasize the importance of affirming these rights through facility practices, public policy, and resident-centered decision-making. Now, therefore, be it resolved that the Gaston County Board of Commissioners proclaims the month of October 2015 as Long-Term Care Residents' Right Month in Gaston County and encourages all citizens to join in these important observances. This to be adopted the 22nd day of September 2015. Cindy, thank you.
Thank
Would you like to say a few words?
I appreciate it. Our event this year is going to be on Wednesday, October 7th, and we hope that all of you take a little bit of time out of your day and come to the event briefly, even just to say hello and thank you to the residents. Last year, we had about 250 residents participate from all of our nursing home and assisted livings across the county. So thank you, guys, and we hope to see you there.
Thank you.
Thank you.
Next is Commissioner Williams with the proclamation for Constitution Week.
Thank you, Mr. Chairman. Ms. Rogers, if you and anybody else wants to come up with you. You sure? All right. How are you?
Good to see you.
Ms. Rogers is actually a part of our family now. Her son had the fortunate experience of getting to marry my sister a couple of weeks ago. So we're glad to have her in our family. Whereas September 17th, 2015 marks the 228th anniversary of the drafting of the Constitution of the United States by the Constitutional Convention, and whereas it is fitting and proper to accord official recognition of this magnificent document and its memorable anniversary, and to the patriotic celebrations which will commemorate the occasions, and whereas Public Law 915 guarantees the issuing of a proclamation each year by the President of the United States designating September 17th through 23rd as Constitution Week. Now therefore be it resolved by the virtue of the authority vested in the Gaston County Board of Commissioners that the Board proclaims the week of 17th through 23rd, 2015 as Constitution Week and urges its citizens to reaffirm the ideals the framers of the Constitution had back in 1787 by vigilantly protecting the freedoms guaranteed to us through this guardian of our liberties, remembering that those lost rights may never be regained. Right. Ms. Rogers, I will give this to you. And if you want to take a minute to say anything.
On behalf of the Major William Chronicle chapter of the Daughters of American Revolution, I thank the commissioners for this presentation. Thank you. Thank you, Jason.
It is a great pleasure for the Gaston County Commissioners to honor citizens who have unselfishly given of their times, talents, skills, and energies in service as an appointee to one of our boards or commissions. This type of service is the foundation for citizen involvement in our county government and is helping shape the future of our community. We gratefully acknowledge the work of the following individuals, and certificates of appreciation have been forwarded to them. Joyce Smith, Adult Care Home Community Advisory Committee. James W. Bailey, Caramont Health, Gaston Memorial Hospital Board of Directors, John Bailey, Economic Development Commission, Kevin Grouse, Environmental Review Advisory Board, John Bailey, Planning Board, Doc Thompson, Sarah Local Planning Committee, and Steve Nye with the Workforce Development Board. At this time, we have no one signed up for citizen recognition. Our next item is a QNRC update. Ms. Michelle Cook. Ms. Cook?
Good evening, Mr. Chairman and members of the Commission. My name is Michelle Cook, and I'm the Vice Chair of the QNRC. And I'd like to thank you for allowing me tonight to update you on some of our program activities that we've been working on over the summer. Basically, we've been looking at two main issues: air quality issues, which will be the focus of my talk tonight, and invasive plant species, which I plan to mention at the end. We all know, and I don't think I think it's worthy of stressing the importance of good air quality. Obviously, there are health effects to poor air quality that impact our citizens: premature deaths, breathing problems, cardiovascular events, long-term exposures. There are environmental effects of poor air quality. These include, pollution is harmful to crops and livestock and other animals. It's damaging to buildings. And then there's the economic impact to air pollution: increased costs to industry, permitting delays, restrictions on industry expansion, and also impact on transportation planning. So we received a report from the Mecklenburg County Air Quality Commission. This is a citizens advisory board to the Mecklenburg County Commissioners. They conducted a 2-year review looking at air quality issues that could impact the health of Mecklenburg County citizens. They identified major air quality issues, and then they researched them and developed recommendations for each issue. There are 9 major issues identified, and they're listed here on this slide: ozone, transportation and land use, mobile sources, outreach with education and awareness, particulate matter, regionalism, hazardous and toxic air pollutants, climate change pollutants, and the maintenance of the national ambient air quality standards. And these are standards that are set by the EPA, required by the Clean Air Act of 1990, that we are required to adhere to. Why is this relevant to Gaston County? Well, one of the issues identified is regionalism. And it's pretty obvious that air pollution doesn't know any boundaries. So planning, policy, regulatory solutions really need to be a regionally based effort. And it's important to note that Gaston County, most of Gaston County, it has been designated by the EPA as part of the Charlotte non-attainment area. So their numbers are our numbers, and vice versa. There are consequences to being non-compliant, or as they call it, for non-attainment status. There's loss of industry. New industry does not want to move into an area of non-attainment because it costs them more to do so. There could be loss of federal funding. The state has to justify any new transportation projects to ensure that that's not going to actually add to the problem of air pollution. New admissions in an area need to be offset, so any sort of industry that's in an area, if they want to expand, they have to take in consideration they have extra permitting requirements. Additional restrictive permitting requirements occur. There's greater EPA involvement in oversight of permit decisions. And even once an area becomes an attainment and meets that compliance, the EPA still remains involved. So it's better to be compliant with the regulations. One of the issues identified in the report was ozone. Ozone's created when nitrogen oxides and VOCs, volatile organic compounds, basically react in sunlight. Nitrogen oxides are emitted from emissions from man-made combustible sources, so engines, factories. And despite the fact that we're trying to reduce ozone level, the Charlotte, Gastonia, Rock Hill metro area is still in the non-attainment status. Mobile sources, which include on-road cars, trucks, buses, and non-road sources such as farm and construction equipment and gas-powered lawnmowers and boats, account for about 84% of this nitrogen oxide emissions. And so this is really where, if we are going to have an impact on reducing ozone, where we have to target our efforts. Another criteria pollutant is called particulate matter, and these are just small they're defined as coarse particles and fine particles. They can have health effects as well. Concentration of these have decreased over the past decade, and Mecklenburg County is in compliance with the standards. However, they're barely in compliance. So if the EPA were to lower the standards, that could then become an issue where we're in non-attainment. So the QNRC looked at this report and tried to figure out where we might have some opportunity where we may be able to have an impact in Gaston County. Two ideas that we've had one of them is to partner with NC Air Awareness to make local businesses and industry aware of the resources that are available to them to educate their employees. And another opportunity is for us to publicize the GRADE program, which I will talk about in a second. But NC Air Awareness is a public outreach and education program that is run by the State Division of Air Quality. And basically their goal is to reduce air pollution through voluntary actions. So what they do basically is they will be invited into an organization, and then they will work with that organization to help the organization develop and implement programs either through their operations or with their employees to try to become aware of air quality issues and reduce pollution and improve air quality over time. The other program that we'd like to publicize is the GRADE program. This is the grant to replace aging diesel engines. This program is already in place, and I think it started in 2007. It provides incentive funding to organizations that replace or repower heavy-duty non-road construction equipment. So since its inception, in Gaston County, there have been 5 projects that have utilized this grant, and which over $255,000 has been reimbursed to the organizations that have utilized the grant program. Overall, there have been 279 projects within our regional area, and over $4.9 million have been reimbursed to people involved in the grant program, and it's led to a reduction of 429 tons of nitric oxide, which is the emission that we're trying to reduce the ozone. And last but not least, I'm going to completely shift right here and talk about the invasive species workdays. So basically, the invasive species workdays is an effort to assist Gaston County Parks and Recreation with their invasive plants. The QNRC and volunteers work on removing invasive plant infestations from the county parks, and we've done this before, but we're having one of our first work days for a Saturday in October at South Fork River Park. So, thank you.
Thank you, Ms. Cook. Is there any questions from the board?
It's on your home cloud.
Commissioner Price?
I believe over the past, say, 7, 8 years, the air quality in Gaston County has improved.
Yes.
I mean,
Yes.
I remember we were on some kind of watch list there for a while, about 7, 8 years ago. If it didn't get better, we were going to lose some kind of funding, I remember, but it has gotten better.
It has gotten better, and engines have gotten better and emissions have gone down, but it's a balancing act. The standards also go down; they become stricter, and so that's an issue. And another issue is that there are more people driving, and so it's always going to be a balancing act.
Okay, thank you.
Commissioner Carpenter?
I've been involved with this in the past, and we had an effort called Clean Air Works. You may be familiar with that we work within the region. And that started about the time Commissioner Price was talking about when we started decreasing it. But it's been two things that's happened. The automobile emissions have been curtailed because of the standards in manufacturing of the automobiles. That's one of the major, and Duke Energy, probably, they made the most significant improvements with the scrubbers that they put on, because we actually have a plant here in Gaston County that uses the byproduct from their emissions, and they making wallboard out of it, the gypsum that comes out. So they're collecting nitrous and sulfur oxides out of the sulfur dioxide, I believe they call it, out of the air. And the rate that I saw that they're getting over 97% of those out that were recently going into the atmosphere. So I think Duke Energy is to be commended for helping us to improve our air quality. And on the reducing of the standards, trying to tighten it down, in NACO, National Association of Counties, we want clean air too, but we want some sort of scientific reasoning for do it, because it's going to be very expensive if they lower the amount of particulates that goes out into the atmosphere. So we're saying, is there any scientific reason to lower that standard? Health reason, So those are some of the things that's going on that I know about.
Any other questions from the board? Thank you, Ms. Cook.
Thank you.
Now, our next item is a presentation by Mr. Chris Dobbins, DHHS Director. It's a 5-year CDC grant. Gaston Youth Connect concludes presentation. Mr. Dobbins.
Thank you, Mr. Chairman. Pull this up. Got you on? Got me up? All right. Evening, Mr. Chairman. Thank you very much. The unfortunate thing is I've got a very few minutes to summarize 5 years of work. What I am very pleased to say this evening is I think you're going to be very excited with what has been accomplished and some of the groundwork that this program has laid for us moving forward. As you well know, 5 years ago, Gaston County was awarded a CDC grant that was basically managed through the state of North Carolina and our APPCNC folks, our adolescent pregnancy prevention folks. And the name of that program was Gaston Youth Connected. The program was over 5 years, again, $5.8 million to reduce teen pregnancy here in Gaston County. We're very happy to report that we not only met the goals of that grant, but also exceeded many of its expectations. The outcomes, the goal, if you will, was to reduce teen pregnancy by 10% over the 5-year span of the grant. Progress to date, and that is only with 3 years worth of data. We're expecting year 4's data to come out next month. We are happy to report that teen pregnancy rates are down 37.5%. We're very encouraged with what we believe will be another year of reduction in this area, and then 2 years of data still to come. Some of the major accomplishments you'll see there on the slide, probably the one that is most impressive is eliminating the disparity between African Americans and white teen pregnancies. Typically that has been a very wide gap in most counties, and not the least of which was here in Gaston County. We are, as a county, decreasing faster than the rest of the state's average, so we're very pleased about that. And to date, we've educated over 5,000 of our local youth on our Gaston Youth Connected programming. Might be of interest to the board, that comes with very significant cost savings. Over the life of a child to the age of 15, there is significant cost associated with a teen pregnancy before the age of 20 for a young mother. Lost tax revenue, support services, juvenile justice possibilities. So the cost savings is not a matter of reducing, it's the matter of not having to spend additional dollars on those services. So these programs, we're very happy to report, will in the long term save many, many millions of dollars. Moving forward, there's been questions in the community, okay, so now what? What happens after the grant dollars are gone? I will tell you the work that has been done over the past 5 years in no small order has increased the partnerships of our community partners. We work very closely with many agencies that we did not work with before. We believe this is the foundation for many of our health issues. We cannot do it by ourselves. And a lot of the work that was done with this grant, we believe, has formed long-lasting relationships that will help us reduce the needle on many of our other, or move the needle, if you will, reducing some of our health issues in the county with the partners that have been formed over the lifespan of this grant. We're very proud of our Teen Wellness Center. For those of you that had an opportunity to come to our Hudson facility, it's a facility that was designed by youth for youth, teen-friendly, deals with a variety of health issues, obviously not just sexual health, but the whole health of a child, where they feel comfortable to come to a facility where they're not judged and can get all of their health issues answered and addressed in one central location. Moving forward, our program continues to get not only state recognition, but national recognition. We have been recognized by the CDC on a number of areas. The state, just last week, ran a webinar where we were presenting the positive outcomes of this program. And Carrie, I believe we have, the state has awarded additional programming to other counties using us as the evidence-based example of how this can address this issue. The model is proven, and I think back to my earlier point, maybe the most single exciting accomplishment here is the understanding and the work we've done with our partners in moving forward. We believe this is a model to address many of our other health concerns. We work very closely with Caramont. We've worked very closely with the faith community, extremely close with our school system, and we believe each of those entities, and as well as some of our nonprofits, we believe will be able to advance many of our health issues moving forward in other areas, not the least of which is the one that we really believe can have a greatest impact on health overall, and that's childhood obesity. So we're very excited about the programs and the projects and the partnerships that this grant over the life of the 5 years has afforded us, not just in the reduction of teen pregnancy, but in addressing other health issues here in Gaston County. And that summarizes 5 years of work.
Thank you,
Any
Mr.
questions?
Dobbins. Commissioner Brown.
Thank you, Mr. Chairman. First of all, thank you, Mr. Dobbins, for coming in and expressing that. Thank you. I get to come in and do the audit, so I get to see a lot of different sides of this, and you guys have put in a great deal of work, so thank you. Just want to let that be known for what you're doing over there to help out, but thank you. Thank you, Mr. Chairman.
Commissioner Price.
Yes, on another note, while Mr. Dobbins is here, I just want you to know that during our meetings of the board each month, Mr. Dobbins makes it clear, very clear to the board and to staff that are in attendance, that when a position opens up at DHHS, they have a review committee that reviews that job, the description, and they don't fill it just because it's a position and it's open. They look at it as it's needed. So I just want to commend Mr. Dobbins for taking that step in what the commissioners have hopefully put forth in combining the two departments as we saw to do. But it's still a work in progress for him and his staff, and they have eliminated some positions. And also, in other respects, they have created new ones that have become known to them. So I just wanted, while he's here, to give him some attaboys on the back and just let the other board members know that that's what a review process they go through each time. Thank you.
Thank you, Mr.
Commissioner Williams.
Thank you, Mr. Chairman. Well, Chris, I guess I'm obligated to thank you as well, and what a great job you're doing. I don't want to be the only person.
I don't think you're obligated, but I appreciate it anyway.
I'm obligated to do so.
Okay.
But, no, so tell Mr. Eaton that we appreciate the hard work he's doing over there and keeping that place going.
Yes, sir, I will. I
Please,
will.
please share the message.
Yes, sir.
The question I've got, a couple of questions actually. You stated that the elimination of the disparity between African American and white teen pregnancy rates was, I think you said that was probably one of the best accomplishments.
It's significant.
Well, why do you think that's such an important thing? If we're looking at the total teen pregnancy rate and we're looking at the amount of dollars it costs or whatever you're wanting to judge it by, why is it so important for that to be a significant area?
I think it's a great question, but I think to frame that answer, you have to look at over the years how great that disparity has been. The underserved, more often than not, there are some challenging circumstances in that community, variety of reasons, But if you look in every county throughout North Carolina, that disparity exists. The fact that we were able to shrink that gap and eliminate it altogether proves that it can be done. And I think that's an accomplishment that needs to be replicated. So when we talk about programming that we're going after or grants that we're going after, these are not gut feel programs that we're going after. We're going after evidence-based. And when you find something that can reduce a disparity like that, that exists everywhere, that's why I think we consider that a very significant accomplishment. Now, the true test is, can you continue to maintain that so that there's a zero disparity between ethnicity, different groups, different cultures? That work is maybe even more difficult, so we hope to continue that. It's an ongoing process. We've been at this 5 years now. The true test is the sustainability of our work. So hopefully I'll be able to report next year that these numbers remain with no gap between the ethnicities. So.
Okay. Well, I'm maybe I wasn't clear.
Okay.
I'm trying to find out why that's so important. I mean, because you made the statement, underserved.
Right.
Was the feeling that whites or African Americans were underserved?
I think you have to ask the question and look at a demographic as a whole. Access to care can be a category of being underserved. Do you have the means by which you can seek care? Do you have access to education? Do you have means by which you can obtain higher education? So there's a lot of factors that go into that. Our job was to connect and reduce the barriers to access, be that education, be that health, and through things like our Boys and Girls Club, through practices, our good friends at Claremont, getting folks connected to practices, expanding our services to Highland, Cherville, Bessemer City, Summit Health. I mean, we've actually expanded those facilities where people can go so that there's not only one place in the county. Many times transportation is a barrier. So that too can be considered underserved.
Okay, well, so I may not be getting anywhere with that.
Okay, I'm sorry I'm not answering your question.
Fair enough.
Okay.
What I would like to see is maybe a breakdown of maybe not solely by race, but by income. I think there's a income level where people may be underserved. I think that's what you're talking about, and I think it'd be important to actually document access to care or whatever you're referring to that you guys use as a measuring stick, based off of somebody's income, maybe their
Sure.
education, their family environment.
Well, there's a direct correlation with income, yes, sir.
Well, I'm sure it is, but all I see here is black and white.
Yes, sir.
It says African American and white.
Yes, sir.
I would like to know, the stability of their home, how many
Sure.
people are growing up in single-family homes. I think these are all things that are also.
I can certainly break it down in great detail.
Yeah.
If you'd like to see.
So I think that would be important
Okay.
to note, and that I would like to see,
Sure.
not just simply, hey, we've brought the disparity between blacks and whites up to where they're equal.
Right.
I would like to see what are we doing as far as encouraging these other things. So if you got that, I'd appreciate it, Chris.
Absolutely.
Mr. Dobbins.
Absolutely.
The other thing I'd like to ask is, you talked about the partnerships you guys have created, and I've heard this throughout the community that you've been doing a great job of reaching out to different organizations. What are some of the groups, besides Claremont, the Boys Club, what are some other groups you have worked with, and what specifically are you doing, besides not just Claremont or Gaston County Schools or the Boys Club? What are some other groups, and what specifically are you doing to try to target these areas?
I think at the risk of leaving someone out, that's the challenge when I say community partners. We've taken a little different approach to working with partners. Not everybody thinks the same way about addressing health issues. One of the things that, and to use an analogy, a buffet, we've taken on the buffet approach, meaning just because we don't necessarily agree on the right way to serve or deal with a health issue doesn't mean that someone in this community does not, or that they might choose to use that service or that method. One of the things we're very proud of, we opened a community room at the Hudson facility. Every Friday afternoon, Crisis Pregnancy Center has a representative there. That was a foreign concept to public health and crisis pregnancy some 6 years, ago. We are open to working with anyone on these issues. Doesn't necessarily mean that our science or that our mandates require us to, but it's one of those opportunities where we work together regardless of our viewpoints. And I think we have more and more of that in this community than we have since I can't really remember when. I've been doing this for about 12 years. So at the risk of leaving someone out, I would ask you not to press me to say which partners, because I would hate to miss somebody who has worked very, very closely with us. But I would say...
Well, who's your favorite? Maybe that's what I'm going
Yeah, no pressure there.
Yeah, no.
Pressure
Well,
there.
I'll leave it at this. I appreciate that. I mean, the fact is, you can't argue with the results. I mean, it's there. It is what it is.
Thank you.
I appreciate your wanting to collaborate with other folks and bring them in. So
Yes, sir.
thank you for all you're doing. And if you can get that information, I'd like to see it.
I will, and I'll pass on your regards to the person who made it all happen. Yes, sir.
Commissioner Brown.
Yes, I just have one more question. You were talking about the childhood obesity strategy.
Yes, sir.
Is that going to be I guess when you say 5 years worth of culmination of work,
Yes,
is
sir.
that going to be an ongoing strategy that we're putting together as well for the childhood obesity? Was that going with the schools, or is that
What our vision, what our goal is, and we're wrapping up our strategic plan, it will be one of our priorities that the board has directed the agency to look into. What I meant by looking at childhood obesity, many of the same things that we've done with this grant, the GYC grant, we're going to model those efforts, those partnerships. One of the biggest partners we're going to have in addressing childhood obesity is our Gaston County schools, working with our school system. So where we plug in and how we work with them, a lot of that groundwork has already been laid through some of our other programming. So to answer your question, we're going to redirect a lot of our county-funded positions to work on childhood obesity, where a lot of those positions formerly were spending a lot of time in teen pregnancy and other health-related programming.
Thank you.
Commissioner Fraley.
Just right quick, Chris, I just want to say thank you too, man. I mean, down 37.5% in 3 years, that's amazing results. And I just wanted to make sure it didn't slip by everybody that's $6.5 million saved to taxpayers in 3 years. So
Yes, sir.
the only thing I'm going to add to it, other than thank you and your department, what all you guys are doing, is if there's anything we can do to help make it better or help it work better, we're ready to do it, buddy.
I have some ideas, but I probably shouldn't say it on camera.
Well, maybe not now, but hey, listen, that's results, and we got to keep
Thank
moving forward with that type of program. Thank you.
Thank you.
Our other commissioner on the left,
Yeah, I'm on the left.
Commissioner Carpenter.
Well, I add my thanks to Chris, and I think Commissioner Brown pretty much asked a question,
Yes, sir.
and it's been on the screen here, 5-year CDC grant concludes.
Yes, sir.
Are you developing a model to continue, and will there be other grants?
Yes, sir. In fact, we've already been awarded grants, not through the CDC, but through North Carolina, through our other programming, that will allow us to continue a lot of the work with regards to teen pregnancy prevention. What we're trying to obtain now are grants that can sustain and basically grow our resources to address childhood obesity. I think what I would say about this grant, it proves what it takes to move the needle on very difficult health issues. You cannot just put one person on staff and say, go fix teen pregnancy prevention. You can't put one person on staff and go fix childhood obesity. It requires so much more and so many more resources and partnerships. And I think sometimes we as an agency take on a little more of a burden in that we feel like we have to do it alone. And I think what this grant has showed us is you don't do it alone. You really energize a community. And then you start seeing the results that I think you saw on the screen tonight. And a lot of those partnerships that were forged through this grant, we think we can continue to grow as we address other health issues moving forward. So going after those grants to staff more, to provide more resources, to expand our teen wellness options throughout the county, talking back to what I was mentioning earlier, access to care, transportation barriers. We're trying to find a way where we can use access now that that is part of the agency, and how we might transport or have those resources get folks to health services. So basically expanding on a lot of the successes that we learned through this grant, carrying that forward, going after more grants with our other health-related issues.
Okay, and just an observation, that $6.5 million that you say that we save or
Yes, sir.
don't have to spend,
Yes, sir.
I would think that's a conservative, but you're only rating it out for a few years.
Yes, sir.
Beyond those
Yes, sir.
first, after 20 years?
After 15 years. Yes, sir.
15 years.
Yes, sir. Yes, sir, after
that-
15 years.
Without this decrease in teenage pregnancy,
Yeah, you won't get a check for that, but you won't have to write a check for that
Yeah.
either.
it's obvious to me that it's a great thing to do. And I commend, this was initiated way back in our Commission on the Family, which I was involved in, and then Commissioner Philbeck picked up and carried it. We focused on divorce at that time.
Yes,
You know, why we had such a great number of divorces. That's went down because people quit getting married, I think. But anyway, thanks.
Yes, sir.
Any other questions? I personally want to thank you. I know when this program first started, it was a little controversial.
Yes, sir.
I think you've done a great job of bringing the community together. I commend you on bringing in the faith community. I think a lot of times when government gets involved with these types of grants and programs in a community, we tend to only see things one way. I think we've been very eclectic in our thought process and how this is viewed, and to have a crisis pregnancy center inside the health department, which, if I'm correct, is the only one, at least when it first started.
According
in
to the
United
emails I got,
States,
yes, sir, it still is.
is huge.
Yes, sir.
And I think it's a program that, whether you agree with certain facets or not, at least the whole community, there are bits and pieces that it can use. And I'd like to, that takes a lot of leadership to be able to do that. And I'd like to commend you on that. Also, I hear you're going to be CEO of the Caramont, and I'd like to commend you on that as well. And are there any other questions from the board? Thank you, Mr. Dobbins.
Thank you, Commissioner Philbeck.
Our next item is other matters. That's what I like. This concludes our work session for tonight. Our next regular meeting is September the 22nd at 6 p.m. at the Harley B. Gaston Jr. Public Forum Courthouse. We'd like to thank you for watching. If you have questions or comments, please telephone our clerk, Donna Buff, at 704-866-3196 and share them. This meeting is adjourned.